And among the shutdown's impacts, workers are expected to be furloughed at government agencies, including the Centers for Disease Control and Prevention, as well as the National Institutes of Health. We want to bring in now Yolanda Jacobs. She is a health communications specialist at the CDC, also a union president representing CDC workers in Atlanta. Yolanda, thank you very much for joining us today. First, can you talk to us about how the shutdown is impacting the CDC? What kind of services are being halted even now?
We are going to see a lot of halting as far as public health assistance, funding to some of our local public health departments. Disease surveillance is basically out the window at this point because we don't have the workers available to meet the needs of the public.
That said, Yolanda, we understand the CDC is one of the agencies partially exempt from this shutdown. What exactly does that look like for you on the ground there?
For us, it looks like a lot of employees that have been furloughed, and then we have those employees that are required to go in, and there won't be any pay for them, and it won't be any pay for people who are furloughed. So it just adds on to the travesty that has been happening at the agency for the past few months.
And Yolanda, talking to you here as a health communications specialist, the HHS specifically noted that CDC communications on public health information will be hampered during all of this. What kind of implications does that have on the public?
It has a lot of implications because when the public does not get the information they need, sometimes we think for ourselves, and it's not a bad thing to think for yourself, but when you don't have the proper guidance that you need, the public health experience behind that, sometimes you make decisions that you live to regret. And moving now into the colder months, we're looking at flu is going to be increasing. COVID-19 is still there. It's still something that is running through Americans. So without that advice, the recommendations that comes out of CDC, we could be seeing ourselves in a worse place than we currently are.
Yolanda Jacobs, thank you very much for your time. We appreciate your insight here.